starting?
We are live now, doctor.
Hi, good evening, everyone. Everybody who has joined us today on to the webinar on choosing the right conferences. This is a roadmap on which conferences to choose for the young ophthalmologist, and age-wise and a specialty-wise roadmap. So I think this will be very useful for young ophthalmologists who are actually confused on which all conferences to attend because they are short on finances as well as on leaves. So I think this will be very productive for all those who are attending today. So we had a first part of this series which covered other specialties like cataract, oculoplasty, and pediatric ophthalmology. This is the second part which will be covering on cornea, retina, and glaucoma. So without much ado, I would like to pass on to Nilesh, who is the secretary of Yosi. So we would like to thank Yosi for providing us this platform. And for the opening message from Young Ophthalmological Society, I would like to ask Nilesh to please take over.
Hi, good evening, everyone. Thank you, Raki, for inviting me. And thank you that you wanted to cut the webinar short and allow me to tell that the best conference to attend will be YosiCon this year. This will be from 19 to 21st July, and we can end the webinar with that. So all the best. I think this is a very nice concept that you have come out with, and I think this is going to be very useful. Last one was a super hit. All the best for this, and see you all at YosiCon.
So thank you, Dr. Nilesh. So now I think we'll not waste much time. We will just go on to introducing the speakers. So first session will be on cornea, and then we'll be having glaucoma, and then we'll be having retina. First, there'll be a speaker who will talk on which all conference to attend, which are the pros and cons of attending each conferences. After that, we'll have a discussion with the panelist after each session. So let's, Gunjan, please share the.
Yes. Wait. Pratima is joining, no? Pratima starts. Pratima is starting first.
Pratima, are you there?
She said not that.
You want glaucoma to go first, Raki?
Yeah, you can do that.
I think
I'll
we
just
do
start.
that.
Yeah,
Dr.
that will be
Madhav
better.
is also here, so I
That
think
will be
for
better.
discussion.
Yes.
Yeah.
Is my screen visible?
Yes.
Yes, Gunjan, it's visible.
Okay.
So Gunjan, you can take over. So Gunjan is
Yeah.
my co-moderator today. She's a Yosi executive and a good friend of mine. So Gunjan will be taking over the glaucoma session. She'll be introducing the speakers and panelists.
Yeah. So good evening, everyone. It's pleasant to see all of you today in the evening. And after APO hangover, all of us are here again talking about international conferences. So the speakers for tonight are Dr. Pratima, Dr. Prasanna, and Dr. Devat. Dr. Prasanna will be starting with what conferences should we attend in glaucoma. So tonight we are joined by Dr. Pratima. This is me, Dr. Gunjan. And this is Ronak. Dr. Satyan will be as a glaucoma panelist. He's a director at Satyan Eye Care Hospital and Coimbatore Glaucoma Foundation. We have Dr. Prasanna, who doesn't need any introduction. He's a research director and glaucoma at Mahatma Eye Hospital, Trichy. Dr. Madhvi has been trained at KMC Mangalore, and she has been regular participant at different national and international conferences, and she always won some or the other grant. And she had won a travel grant at World Glaucoma Association in 2023 and 2025, and also World Glaucoma Conference in Rome in Hawaii. And then we have Dr. Vaibhav, who will be in the retina session, Dr. Devat, and Dr. Prithvi as well in retina session. So we'll start with Dr. Prasanna as a glaucoma speaker. So Dr. Prasanna, can you start your slides?
Yeah, just sharing my screen.
Prasanna going first. So then, like, are we changing the sequence or something?
Yes,
Sorry.
yes.
Okay, no problem. Thank you.
Do you want to go? Okay, fine.
If it is okay, I can also go ahead if it's okay with you.
Okay, fine. Raki, what do you say?
Yeah, anything is fine. Anything is fine.
Yeah, okay, thank you. Thank you,
Yeah,
Raki.
they called you, but since you are not there.
Yeah. I just said
Yeah.
for 2 minutes. So I joined.
Perfect. I can wait. Ladies
Thank
first.
you. Thanks a lot.
Done.
Okay.
Gunjan, then you can share Pratima's.
Yeah. So Dr. Pratima will be talking about cornea conferences. Uh, so she's sharing the screen already, so let her do that.
Okay.
Okay. So good evening, everyone. So today I will be talking about a roadmap to cornea conferences. And before that, I would like to say a little about why you should attend these conferences. Am I audible clearly? Is everything fine?
Yes, Pratima, go on.
Slides are also visible, right?
Yeah.
Okay. Okay. So, firstly, I would like to say why you should attend these conferences. So, these conferences will give you a very good exposure to the latest cornea surgeries available as well as the diagnostics which are available. It will also help you understand the research methodology and the trends, and it will also help you to network with mentors and future collaborators. So, when you go to higher conferences, you can find mentors and you can discuss with them. Maybe even if you need some smaller fellowships like or observerships, you can discuss directly with bigger mentors in maybe national as well as international conferences. Then it will also give you great visibility through posters, papers, and videos. So there are different levels wherein you should attend different types of conferences. Sometimes you can even mix and match. If I say that these conferences you should attend during your residency, it's not very hard and fast. Even during your residency, you can go for international conferences and vice versa. So first level can be conferences specific to residency, then fellowship, as well as while you are a consultant. So these are few of the conferences which I got to attend during my residency. Luckily for me, though, I never knew that I would take cornea during my residency, but still my mentor was a cornea person, and I got to attend conferences and present cornea topics during my residency itself. So if there are any residents in this, you can take up, means you can start attending conferences from now itself, which will give you a very good platform and understanding of each and every conference. You can target basic conferences first, that is your regional conferences, and then go ahead with national and international conferences. In the regional conferences, you may not just visit there and just you can see you can attend the different meetings, but you can also try to participate in different types of quizzes, try to participate in PG grand rounds, as well as present papers for different genera. Then these are few residency specific conferences which will give you kind of a crash course. So earlier IPEP, which is a very good conference in LVPI, was called as IPEP. Now it is called as 3H, and it will be between 4th to 9th of May. This is very helpful for people in residency. iFocus is a very good conference for residency. Earlier, it used to be I2I in MM Joshi. I don't know what it is called now, but it was again a very good kind of crash course for residency people. So during your fellowship and consultancy, you can target conferences both in national as well as international levels. And it can be either specific to cornea, or it can be a general conference where you can meet a larger audience and you can present your cornea topics. So the national conferences, which are very specific, would be first and foremost would be Keracon. I don't means I try to attend Keracon each and every year. It is very good for learning as well as for presenting as well as for collaborating. Then the next conference I would like to say is about Bugbuster. This is a very niche conference, specific not only means even within cornea, it is specific to microbial keratitis, and it almost covers all the topics related to microbial keratitis. Then there is OSW. So this is ocular surface workshop, wherein means I never got the opportunity, but I definitely want to attend this one also because it is more specific to ocular surface conditions. And these three conferences are the conference where I just don't go for presenting, but I go for learning also. It sums up almost all the topics of cornea. These are very well organized and very good conferences for cornea. So then there is EBAI, that is Eye Bank Association of India. This is also very cornea specific conference, which any of the cornea fellows and faculty should definitely try to visit. This is one conference which I just came to know about, that is ISCKRS, Indian Society for Cornea and Keratorefractive Surgery. I never attended this one, but maybe in future. Then there are some general conferences wherein you can meet larger audiences and present your topics, as well as meet a lot of people, collaborate and all. So this is one of the conference, that is All India Ophthalmic Society. YosiCon has also started nice national level conferences, which has now gone international also, and you should try to target this also. Then there's IRSI, which is more specific to cataract refractive, but still you can attend this one and present your cornea topics and meet people in all subspecialties. And then there is state and regional conferences. Like there is DOS, which is more national conference, but more commonly organized in Delhi. Then in your own region, like I am in Maharashtra, so I do target conferences in Maharashtra, that is MOSCON, WOS, OSN, and BOA, that is Bombay Ophthalmic Association Conference. But in when I was in Telangana, I was attending Telangana Ophthalmic Society Conference, and when I was in Odisha, I was trying to attend OSOCon. So wherever you are, you should try to attend all the conferences in those regions also, because it will give you a very good coverage in that region. So do try to attend all your regional conferences as well as state conferences, and never neglect them for being smaller conferences, because these will have a very good opportunity for you in your own region. So then there are national conference, international conferences. Some are very specific to cornea, like UCornea, Asia Cornea Society Conference, and Congress, Cornea Congress. So these are the conferences which I would like to attend in future. They were very specific, so I never got the opportunity yet to submit my abstracts there. But definitely, once you are into a higher tier, you are a bigger faculty, you should try to attend these conferences also. Then there are general conferences of international level. Like I have attended AO and I have submitted videos and my presentations there also. So you, even if you don't intend to attend, if you have submitted your videos there, then if that gets accepted, that is a very big achievement. So you should try and target these ones, that is American Academy of Ophthalmology Conference. Then WOC is there, World Ophthalmic Congress, ESCRS. And then there are certain conferences which are more oriented towards Asia Pacific region, that is APAO and APACRS. So these conferences have this, that they sometimes are organized in India too. So even if you don't want to travel internationally, you can try to attend these ones in India itself, and it will give you very good leverage. So then there are many other conferences which are internationally available, and you keep getting mails about them. But these are the ones which I specifically know about, and you should always try to attend and send your abstracts there, and you should get a better idea once you attend it. So one of the initially you should try to attend and get an idea. Maybe when you're going internationally, it is much more beneficial that if you submit your abstract also and then go to the conference rather than directly attending a conference internationally. So during your early training, you should prefer national and regional conferences, also skill-based meetings. Like I told you about Keracon, Bugbuster, OSW. So all these will have wet labs wherein you can develop your skills. If you think that your institution is not giving you specific skills like learning of BSEC, BMEC, DAL, then these conferences have very good wet labs also, and especially like Keracon, and you can try to learn your skills, enhance your skills in these conferences. Then there are conferences which are very abstract friendly, and you should definitely try to submit your abstracts in these conferences. And then you can go ahead with international conferences. For the cost of the conference, earlier there was a very good session by Yosi itself, wherein they have told you several ways where you can achieve grants and fellowship means travel grants and all, and these can help you out with the conference cost also. So you should try to attend, observe, and you should try to find network in these conference. Submit as much as possible. Like should submit your photos, posters, papers, videos, whatever you can in these conference, because it will definitely help you build up your CV. Then once you're at a higher tier, you should try to chair sessions, moderate panels, and mentor juniors in these conferences. And then all these will help you build a visible academic footprint. So conferences are just not career accelerators, but they are not just meeting, but they are career accelerators. You should plan ahead. Like if I want to attend a conference like AO after 1 year, and I need to submit a free paper for that. So for that, I will start planning from now. I will try to, whenever I'm in clinic, I will start planning what cases I can actually present. I can build up a research on that, and then I can submit a CV. So 6 to 9 months ahead itself, you should start planning on what conference would be your next target, and you can start preparing your abstracts accordingly. So use conferences to not just present, but to find mentors and collaborators. Whenever I go to any of these conferences, I try to talk to people. Like if I'm going to a Konya conference, I would definitely meet Susan Jacob. I would definitely like to meet others like Dr. Fogla, talk to them, learn from them. And also, if possible, if I can visit them, I can ask them. So that gives me an opportunity there also. So grow from just a attendee to a presenter as well as then to a faculty in these conferences, and this will help you build up your CV. After building these CVs, I got the opportunity of after my foreign fellowships. Like for that, my CV was built up from these conferences itself. And once I went through the foreign fellowships, I got this good recognition like Yosi International Rising Star as well as International Hero Award from my own regional conference, that is MOSCON. So these help you a lot. So try to attend all these conferences. If any questions, please let me know. Thank you.
Thank you, Pratima. That was a wonderful talk. You have covered almost everything comprehensively. So after this, we'll have a discussion on this topic itself. We'll have few panelists also joining with us. Dr. Gunjan, can you please share the slides of the panelist again?
Thank you, Raki, for giving me this opportunity. And thank you to all the UC people.
So for the Konya session, we have two panelists. Next one. Dr. Gunjan Budhiraja, who is also the co-moderator. She is a cornea and anterior segment specialist who is currently working at Dr. Shroff Eye Hospital, Delhi. Previously, she has completed cornea and anterior segment fellowship at University of Ferrara, Italy, and she has multiple publications. And she is also a Yosi executive. And our next panelist is Dr. Ronak Solangi, who is also a cornea specialist who is based in Mumbai, and he has over 12 years experience in the field. He practices at Neo Clarity Eye and Dental Care in Mumbai. He has completed his MBBS from Maharashtra University and his DNB from Arvind Eye Hospital. So we are very happy to have both of you, Dr. Gunjan and Dr. Ronak. So now we'll have a discussion. So today we are actually joined by a cornea specialist who was a fellow and she has started her practice. She's a young ophthalmologist and she is actually acing in her career. So she is having few doubts and questions to ask to the experts here. So I welcome Dr. Vishwa. I hope Vishwa is here.
Yeah. Hi, Raki. Pratima, wonderful talk.
Thank you.
So I think Pratima has covered everything wonderfully well. My few questions for everyone's benefit, I would like to ask the panels. Like during fellowship specifically, what would be the non-negotiables that would someone look for? Specifically, a fellow would look for in a conference. Like specifically for Kerecon course, would it be a skill transfer or a refractive focus meeting? Because that is something which not every fellowship gives, or a specific topic related, like Pratima mentioned, bugbusters or OSW. Like during fellowship, what should one aim for?
Dr.
Gunjan, would
Ronak.
you like to go first?
All right,
Okay.
okay. So yeah, as a cornea fellow, if you're asking me as a cornea fellow first, so I think when we start with cornea fellowship, the first things that we are usually dealing with is infections and C3Rs. As in my institute, we had these kind of starting points. So in the beginning, I think Bugbuster, I think that was the first conference I attended as a fellow, and I submitted my abstract as well. And keep on nowadays we have webinars as well, so it's just not always the physical conference. You should always keep on presenting cases so that you can get a head on in the physical meetings as well, and also try to present some cases in kind of blockbusters and some specific meetings where you can get specifically you can get a podium presentation experience and also get inputs from the other people and panelists, and also you have people from different institutes where you see their cases as well, so you learn a lot from these kind of case presentations. So as an initial fellow, you should opt for something which is going on during your fellowship, and then you move on to whatever, like in the last leg of your fellowship you would be exposed to refractive fellowship or ocular surface. So I think according to me what I started doing was that way only, because that's how you are seeing those clinics and you have those cases. So you keep your cases along with the faculty and keep on presenting in different conferences. So that is what my input would be from my own experience. Rest, Dr. Ronak, whatever you want to add on, please.
Correct. So I agree with her that so basically in a cornea fellowship, for example, if it's a 1.5 year, 2 years, 18 months to 24, it's impossible to just get, a hang of everything. Sometimes it's better to just identify two or three subsections which you are interested or which cases you see more commonly. Like if you're doing a fellowship in South India, you will get a lot of infective cases like that. And Bugbusters is a great meeting. So I would suggest that you should go for these 2 days intensive closed group meeting and workshops rather than, a larger general conference like an AIOS where you will have sessions, but not an intense discussion over a period of 1 or 2 days. Like Bugbusters, if you go, it's a very intensive discussion about infective keratitis and all. Similarly, other institutes like Narayan Nethralaya or other places, they have extensive discussion over how topography, from the basics of topography to the finer nuances of refractive surgeries from the tried and tested methods to the latest ones. So these 2 day workshops are really intensive. It's very beneficial. Identify 2 3 areas like when I was doing my fellowship, I as Dr. Gunjan said, infective keratitis, keratoconus was one of my areas of interest. So I picked up those, and also yes, having you presenting your own cases will give you a third person's view of what you can do or what other people are doing, what is evidence-based medicine and all those things. Try to take up topics and do research about it extensively. And yes, going to these closed group meetings would be a preferable choice than going for a general state conference or an all India conference or an international conference also, I would say, to begin with. Later on, you can, as and when you have time, you can also add on to these things. You will meet a lot of key opinionated leaders in the field who will be pioneers of some techniques and all those, and you will get a chance to have a hands-on workshop, a wet lab. There are a lot of doctors and hospitals who now have hands-on courses. And as Dr. Gunjan said, post-COVID, it's been a boon that you have these webinars where you can also attend instead of physically going everywhere. So yes, target your few subsections which you are interested in, you go all out on those.
Correct. Thank you so much. And what about like if someone is just starting their practice, like what all should they focus on? Like where all should they submit their extracts? Or like this is for someone who's finished their fellowship and they are in either some senior residency
Correct.
program or private practice or something of that sort.
So in the same approach, you can do it at all sections. So in private practice, once you're into practice, you may explore the ones which are like a Asia Pacific conference or an ESCRS. The advantage of all these things are also as long as you're a young ophthalmologist, like for example, ESCRS, if you become a member of ESCRS, apart from the conferences which you get at a slightly lesser price and everything, you also get their on-demand access and the education portal, which has a lot of learning material. So you can, pick up how to make good quality videos or case presentations. And there are a lot of material available for you to see. Like even now there are options of, there is an option to attend these meetings virtually also now. So you don't need to travel all the way. You can attend them virtually. Like for example, the recently concluded APO meeting which some people would have not. It's not possible to attend all your sessions because some may clash. So they give you an on-demand access for the next 2 or 3 months so that for the sessions you missed out, you can even go back home and catch up on them. So, and there are a lot of, so it's a different outlook at these conferences, and there are a lot of wet labs, training. Now, MIGS, I was interested in MIGS in my private practices, which is a totally different thing from my cornea practice and cataract practice. So at ESCRS and other places, I met people, I attended sessions, I did a hands-on MIGS wet lab. So just to get a hands on. So you know what you want to do next because you want to keep learning more and more newer things, even though if it's not your own cornea specialty or something like that. That way.
So I would also like to say when you are starting your private
Yeah.
practice,
Okay. One more question.
can I take this? Hello?
Yes,
Yeah, so when you are starting off your
Yeah. Yeah.
private,
Yeah. 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 Yeah.
also try to increase your visibility in your local conferences. So because you want your local people to know that you know the stuff, okay? Like you know about cornea, you know about how to diagnose, how to manage, and you know you are doing these surgeries. So if you are doing maybe DSEC, DMEC, you want your general ophthalmologist also to know that yes, you are performing these surgeries too. So when you are just starting off your practice, you should try to attend all your local conferences, try to present there as much as possible, especially your surgical skills. That you should try to people should know about it. So try that also. Apart from the higher conferences, go to all your local conferences.
absolutely agree.
Correct. I think that is most important in your private practice specifically because you want to be visible to them. Like you want
Yeah,
people to know about what all you have in your armamentarium. Yeah,
definitely.
definitely. So small group CMEs help a lot,
Def-
like in that.
Definitely. Even like if you can go as a CME speaker, like you are the main speaker, that helps even more.
Yeah,
If like you are giving a 1 hour session in your local conference and people are asking you questions, I think that gives you a higher leverage. And try to attend all the conferences which are like nearby to your city, smaller villages or something, and present CMEs there. That also helps a lot.
especially when you are practicing in tier 2, tier 3
Yeah,
region,
yeah, yeah. It
that
will
becomes
build up your
very
practice
important.
also.
Yeah.
Yes.
Like even if it is not a general opthal meeting, it can be a very like basic group or something. But if you
You
present it,
can
it
even
gives
go to
you
a
a lot.
medicine conference and present about dry eyes, and then you can get maybe even referrals from medicine people. So it helps you a lot.
Yeah, yeah. So this is something we had done here. I work in a tier 2 city and we had medicine people, pediatrician people, like local IMA meetings I had presented. So they also know what all like it is for them, it is what all to refer to a cornea specific specialist and specifically to even for ophthalmologists, general
Correct.
ophthalm. So
Correct.
that's yeah, wonderful. Thank you so much, Dr. Ronak and Dr. Gunjan.
Yes,
Rakhi, you are starting the
thank you.
next.
Thank you.
Yeah. So I think we had a very good discussion, which will be very useful for all budding cornea specialists. So now we'll move on to our next session, which is in glaucoma. Can you please share the slides, Dr. Gunjan?
Yeah. Give me a second now.
Uh,
So
I
for
should,
Uh,
glaucoma,
Rakhi,
our speaker is Dr. Prasanna. I think we don't need to give an
yeah, I'll share
introduction
the
about
screen.
him. So we'll just go on to this talk.
Thank you, Raki, for the kind introduction. Yeah. Hope my screen is visible. I was
Yes,
going
yes.
to the
yes,
conclusion
you are
slide.
Conclusion
on
first.
already on conclusion.
Sorry for the technical glitch. Hope the screen is visible.
Now is fine.
And
Yes.
yeah, perfect.
Yes.
So choosing the right conference for your ophthalmology career or your glaucoma career and age-wise and subspecialty approach. So we did see the previous speaker, Dr. Pratima, speak about the different arms. So I'll avoid those different arms because the arms are similar to glaucoma as well, your state or your district, your regional, then the national. So I'll just try to add on a candid and a very personal take of how you can actually go about it. It is just one step, or rather one path. It doesn't need to be the same. Each one can have their own journey, and it's going to be more of how I prefer or how I do it, and choosing the right conference. Thank you, Raki. Thank you, Gunjan, and these are some of the conferences that I have personally attended. And to name other conferences are the district conferences, the Trichy Ophthalmic Society, the TNOA conference, the other state conferences, and of course our own Yosi conferences. So why conferences? Again, conferences where we go and we network, collaborate, opportunities, and how you choose your conferences so that you start growing academically, as well as there should be a growth when you move towards conferences, right? So that is very, very important. So in your career stage, initially we all go towards an academic goal. It can be a presentation or it can be publications where you can do collaborations in conferences, networking, and leadership roles. Geographic strategy is very important. What can we choose? And if you are a resident, the goal is, for me, it was always my Trichy Ophthalmic Society or the Tamil Nadu Ophthalmic Society, the state or the district that the previous speaker spoke. That is where the first podium or the first case presentations or the first posters will happen, or the first workshop, as Dr. Ronak was beautifully telling about his mixed learning. I have learned personally many things from workshop, and I totally agree with Dr. Ronak. So that will lay the foundation. So in the early days, 2017 onwards, I start attending TNOA conferences, and aim big in those conferences is what you should start your journey in. Some named awards or in your specialty, what are that? So for example, in TNOA, we have this V Velayudham session, as well as the CP Gupta will be the best of best. So try to see how we can hit a niche in that particular specialty. And of course, keeping a track on your local conference, like the Trichy Glaucoma Forum meet that myself and Dr. Vinod Arunachalam sir was able to be part of and founded it. Raki, I think, has done YOLK similar to that. So make sure you are active in your region, which is very, very important, because your district is where you start, your state is where you go. And as a resident, when you go to conferences and when you present something, whether it's a paper or a poster, you should see how you can maximize choosing conferences which helps you convert it, into a paper, into a publication, and it also gives you your visibility for what you actually went for. Like, you choose a conference where you get visibility and you take a faculty role. So that is another way of thinking, okay, which conference that as a resident or as a fellow I'm going into. And when you submit your abstract, different conferences will have different arms. For example, in glaucoma, think in terms of not only clinical but surgical innovation, AI, case reports, or pedagogy. How you can, target different subspecialties in that specialty itself in glaucoma, and also photography, videography, submissions like that. So you need to completely see these arms when you choose a conference. So for example, if you're going to an ASCRS conference, ASCRS will have certain pluses, certain things will not be there only. So you need to know what is there in that conference. What is an oral presentation? What is a rapid fire? What is a poster walk? What is a poster podium or a Hyde Park? What is a photo competition? Is it going to be an on stage or an off stage? Just a minute, physical ICs or workshops. So when you take a conference, see again, film festival, some conferences may not give much weightage to film festival, but if you take ASCRS, they give more weight to film festival. So make sure you target these kind of conferences and see how you can align the conference in that way. And again, once you are 3 years to 7 years post residency, if for glaucoma, I always advocate going slowly from your state, move towards GSI. Yosi is also there. The glaucoma focus group is doing a great job under Arshi and Dr. Shivam et al. Then you move to APGC, WGC. APGC is Asia Pacific Glaucoma Congress. That is Asia Pacific. WGC is World Glaucoma Congress. And then some allied factors like APACRS or ASCRS as a glaucoma arm. So that is where I told you, right? So this is just a personal take of it. Identifying the subspecialty is very, very important. GSA is where the national journey began for me. AOS is another one where there is subspecialty days, but GSA will give you the real complete thing where people will discuss. You get to present your videos. You start making your niche. They have the diagnostic category. They have videos itself. They have two categories: best diagnostic category, best management category. They have newsletters with crossword newsletter things. They have an innovation category. Dr. Shivam again was part of it. Dr. Mega. You can see many OC members. Dr. John Davis. So we all travel together in the innovation category. Glaucoma pitch is what they label it. So then see how you can publish your work in AO's allied journals like IJO, where one of my glaucoma articles on AI was the IJO Silver Award in 2023. because you don't end there. So you have to make sure once you move on the other side, push international, because international is the way forward. Networking with Dr. Aik Ahmed, Clement Thamser. These are people who are very active in the global conferences like APGC, WGC, and other things. So as you start moving the ladder, right? So WGC is another one in glaucoma, where every year in AAOS they have a session. So we need to now move towards which conferences have a session in India, because not every time you will be able to travel abroad, right? So think in terms of, okay, where can I represent WGC in India? So you can represent the World Glaucoma Association in India. Whenever AOS happens, you can be part of their sessions if you are able to, your work and your publications will be able to make a mark. And, this was the World Glaucoma Symposium where Dr. Surinder Pandav sir was actually citing my study in the WGC symposium. So these things will happen with more calculative approach as to how you want to go into and connect with the people in India itself. Not, you don't need to go to a World Glaucoma Congress to actually be part of the WGC session, because that happens in India as well. And once you do that, it'll lead on to the next connection. That's all about it. So once you move to a conference, you need to have a clear plan. So I was able to connect with these stalwarts thanks to Dr. Tanuj Dada sir, who gave me this opportunity in 2024. And once you talk together with all these stalwarts, you will see that you can start publishing together as well. After this talk, I got this opportunity to work on a mixed module, because that's how the people abroad work. What they are soon after the conference, they start bringing out a module of the same talk itself. So I was able to publish intraoperative gonioscopy along with these people. So once you publish after you come from a conference, again you will get more idea as to which conference you can choose and maximize that conference. Global subspecialty is another one which I feel any resident or any fellow who's watching it, you aim for the globe. That should be your end point, because the grants and the other things are there till 40 years of age. And this is one of my favorite slides. In 2 years, I was able to travel 3 continents, 6 countries, all because of grants. And make sure you utilize it, because choose your conference, or rather the conference chooses you. Whichever conference you get grants, you just go for it. Like the 2019, when I went to World Glaucoma Congress in Melbourne before lockdown, COVID, I don't know why, but as Dr. Ronak was telling, something made me go for hydrus and glaucos, wet lab training. That time, 7 years back, it was like Greek and Latin. Nobody knew. Hydrus just came to India last month. And I was the third surgeon to do hydrus in India, because I invested 7 years back itself in the World Glaucoma Congress. And I was able to be in touch with them, I stent inject. And not that alone, we can also become trainers. I can see Dr. Madhavi ma'am on the other side. I personally got inspired from her in Suture Gat, and our center is training a lot of people. So you should benefit from the conference and also apply it in your practice. That is how you go about things. So what happens, you should be able to predict it, like eye stents which are there, or hydrus for that matter, as I told. So these are some of my videos of hydrus. So you should know to which conference you should go as a specialty surgeon. So glaucoma surgeon, I have now crossed around 10 years into the field after I completed PG. So now you should know which conference to go, then pick the niche and come back and apply these things, so that you will be able to be a friend forerunner or an authority in MIGS or angle surgery or whatnot. And for young surgeons out there, I told you, right, let the conference choose you. Grants. I think, again, I would like to acknowledge Dr. Madhavi ma'am here, who's part of the panel, like Professor Yasuo Tano grant and WGC grant. We have all won that together. Let the conference choose you. You'll be shocked to see you get 1,000 US dollars in APAO. That is more than enough for your air tickets and your accommodation. You can have an accommodation very close to the venue, and you can have magic there. WGC gives you 1,000 euros, and Rome I was able to attend because of it. Hawaii again I got 1,000 euros. These all happens only when you are less than 40 years or sometimes 45 years of age. World Glaucoma Congress gives you grand rounds, and make sure you utilize that. Make sure you utilize the posters. Again, you can be part of the World Glaucoma Congress by going through GSA also, the national body. Similarly, other way around. So both ways works. You can have a GSA session in the World Glaucoma Congress. The World Glaucoma Congress will have a GSA session. both ways. You can be part of these organizations, be part of it, and make your work, pitch it there, and connect with like-minded people who actually propel you and motivate you, and hit it hard. Posters, rapid fires, case presentations. I always feel you should hit it in every category so that you never know where your work gets recognized, and never miss a chance to train people. So whenever you get a chance to train people in wet lab, in foreign conferences, because these are areas where they find it difficult. So that is where your need is more, right? Even in APO recently, you would have seen a mail that they wanted trainers for wet lab. So when you get a mail like that, choose those conferences, because you get mentees there. You will train 10 people in mix, and they will take your, you will become a mentor for them. And that is a very, very great relationship. Rather than going for a talk for 10 minutes, I would choose a workshop for a day in an international conference or a national conference. And of course, you will definitely win along the way. That will give you more motivation to attend. So this was last year's WGC, when I was able to win the grand prize in the World Glaucoma Congresses. And these are moments that the conferences will actually choose you. And I was able to acknowledge my mentor, Dr. Satyan, there, and I take pride in acknowledging my mentor, because these are moments that make you grow more further and further. And choose those kind of conferences which gives you that joy in acknowledging your mentor, like these on the podium, right? They have this very informal award show where 15 minutes you can talk about your video, and then they bring your mentor on podium, or you can acknowledge whoever you want. That's growth for me, according to it. Have photographs, participate in all other things, increase your visibility, push from district, state, Asia Pacific, then to the globe. These are the things, my dear friends, which will actually give you joy. You have presidential dinner. Attend conferences where you are able to enter the presidential dinner, where you can meet the who's who in that ophthalmology, because that is where you will be able to network on a different league for your projects. Choose where you get inspired, and then you get the next invitation, right? So that's how you move one step on the other. And like the conference in APGC and travel grants, as I said, never, never, never ignore travel grants. So these are some of my own personal grants. I won close to 8 to 9 travel grants. Most of my conferences, I go through travel grants. And go to conferences where you get invited to speak for 2, 3 minutes. You have podcast sessions, make use of it. And even use our state organization, AOS, as these travel grants, and they recognize you for your grants. Make use of it, because as a young ophthalmologist, if you win awards like photography awards or travel grants, you get certain extra perks. Like in APO, you get a free cultural pass. So these are the conferences you should actually maximize, because you not only go and present yourself, but also you get the free ticket or free pass to go to the cultural night. Like this year, we had the Ocean Park free pass, and 3 to 4 hours in Ocean Park in APO. It was completely reserved only for the delegates. So just winning a competition like the APOS photography competition will get you that. Network with global leaders. If you are aspiring for leadership, go to conferences which has their own LDP. Choose those conferences, because you'll be able to network with more people. And once you network with more people, this was one of my books that I brought last year out. And I was able to collaborate with 51 co-authors across India, because that's how you grow. You network, you collaborate, you bring out with like-minded people, and then you come out with your own projects, and then you grow like that. That's where conferences come, and you launch your book in the same conference which values it. Like yesterday, you would have seen a mail from AOS stating, if anyone has a book, please send us and we'll launch it for you on AOS. I hope you would have all seen that mail. So check your mails, choose those conferences, launch your products or your book, your innovations there, and make sure your work is spread out in globally. And you can be your own leader. You can represent your country in every scale, and choose conferences and certain areas like where there is a conference marathon walk, conferences, newsletters, network with people like Professor Clement Tam is one of the guys that I personally learn a lot when it comes to glaucoma, especially angle closure, and trying to see how you can share podiums with them if there is any possibility, like, network with these people and upgrade yourself through conferences, and get yourself into newsletters. Either you can be an author, or you can be organized from an organizing team point of view. You can always be on the other side and contribute to those newsletters. So maximize everything in those conferences. Like, as I told, again, I would like to acknowledge Dr. Madhavi ma'am here. She was the previous recipient of the Yasuo Tano grant, and I was lucky to get it this year. And that covers your whole thing. And also focus on innovations, ICs, instruction courses, focus on other areas like Media Mice is the company which has their own recognition things. Go with them, see how you can get featured in those, and utilize every possible resource. Accommodation grant. This is one of my ASCRS accommodation grant where you can see I checked out from JW Marriott, zero bill checkout, 5 days because of a grant. These things, my dear friends, it is only available till you turn 40. After that, you can't get this. It's called the housing grant. So if you want to travel international, there are other grants like innovation grants like 5,000 US dollars. So you not only go and present your work, but you also win a grant for it. That's massive, right? So choose those kind of conferences where your work speaks, and that's it. Just keep your idea forward and keep on going. So these are some of the conferences I personally choose: ACRS, APAO, APGC, AOS, and my state and the district, and of course Yosi, because this is where you really grow. But the step ladder will always make sure that your foundation is strong. I still make sure that whatever happens in Trichy today, I'm very keen because I feel that is where you start learning. Never try to lift 100 kgs on day one, because it starts with 1 kg, 2 kg, and then slowly your kilograms get increasing and you will be lifting 100 kgs. So conference selection must be strategic, not emotional. Subspecialty identity is built 3 to 7 years. Between those 3 to 7 years is a very key area once you complete your fellowship. And regional platforms act as academic bridges. Global authority requires sustained abstract productivity. People always think you want to become a faculty and move the other side, but it doesn't happen like that. Even today, uh, God willing, we are all part of the other side as faculty, but still we've always submit abstracts, because your abstract is where your original study gets delivered. People see the abstracts. So abstract is the key. Always your original article or your original study that you do, the abstract productivity is very important. And even today, participate in abstracts, posters, papers, rapid fire sessions. And of course, if you are interested in leadership, that's personal choices. That will define long-term academic legacy as well. You can bring in policy changes and you can uplift more and more people if you have the vision and attitude and aptitude for leadership. So thank you again, Raki, Gunjan, and the whole international team for giving me this opportunity. And these are some of the areas where you can catch me on Instagram, email ID, or WhatsApp, and I can candidly guide you if you are interested in any one of the conferences or any one of the things that I just shared. I would be able to guide you on one-on-one as well. Thank you.
Thanks, Dr. Prasanna. That was a powerhouse of the presentation. And I think people would have learned a lot from what we should do, and the travel grants, how we should, get all those things was cherry on top. So I think Dr. Arino John is with us, and I think he wants to
Mhm.
ask some questions from the panelists. Dr. Madhavi, sorry, I'm sorry, Dr. Arino. So I think she would like to ask some questions from the panelists, which is Dr. Madhvi ma'am and Dr. Prasanna here. So Dr. Arino, do you want to ask some questions from our panelists?
Yes, yes. It was a very insightful presentation by Dr. Prasanna. Thank you. My question is, as a new glaucoma specialist, like which conference is non-negotiable, like other than the All India conference or our local conference? For glaucoma specific conference, which one do you suggest as a first conference to attend, and which gives you as wet lab access as well?
Madhavi ma'am, you want to take it?
Yeah. Sure. So there is nothing like non-negotiable conferences. Let me put it a different way from Prasanna. This was a mind-blowing journey, but not everybody's journey will be like that. He also mentioned that. So mine was a completely reverse journey because my first conference I think I applied was WOC, not GSI when I entered the fellowship. So it is something I wanted to tell the entire young ophthalmologist. Don't limit yourself. Don't think you have to start small and then go international. If you have a good abstract, you can even apply, start with an international conferences also. So that is the first point I want to say. You can start simultaneously also, but at the same time, don't miss out on the state conferences or the national conferences also. So if you're something you want non-negotiable, of course it will be the Glaucoma Society of India conference, where you get lot of wet lab opportunities and all. So as an at the learning stage, at the fellowship stage, that is one of the non-negotiables, if you can say. But at the same time, as I already told, don't limit yourself by not applying to the international conferences, because you may win. You will never know.
Yeah.
Prasanna's journey was like a wonderful roadmap, but my journey was completely reverse. Okay, so the first year when I applied for GSI, I didn't have a single acceptance, but at the same time, WOC accepted the abstract. Not even a single abstract got accepted by GSI, but WOC accepted the abstract. And even World Ophthalmic Conferences, this time it is happening in Prague, they have travel grants. So you have to familiarize yourself with the travel grants also, because being a young ophthalmologist, finance will be a problem. That will be one thing that will be limiting you from attending these international conferences. So I hope I answered your question. Maybe Prasanna can add on
Yeah,
that
no,
also.
I actually wanted to add, since Dr. Madhavi ma'am is here, Dr. John, Arino John, if I'm pronouncing you right. See, at every conference, you need to have a take-home message. Even, see, I take webinars also very seriously, and I've told ma'am also this. So we had a webinar in 2023 where I was operating all MIGS except Suchagat. So once you go for a conference, I was having a debate with Dr. Madhavi ma'am here. She was talking about Suchagat, I was talking about KDB and iStent. So we try to learn something extra. That is the key takeaway, is what I always keep in mind. So because after a point, no, in the starting phase, you will have a spike. Whichever conference you go, you will learn. Until you become a specialized surgeon or specialized doctor in that subspecialty. After a point, you will try to reach a plateau. So that is first 3 years, and I divide it as 3 to 7 years. In my talk also, that's what I highlighted. The first 3 years, I also totally agree with the Madhavi ma'am. Like if you can push, like you are submitting something which got rejected in your state conference but got accepted in a international conference, you should go for it. That is how it works. And at the same time, after you cross those 3 to 7 years, like ma'am and myself, we are slightly on the other side. But still, you should learn something more when you travel, because you should maximize how much you can learn extra one more point. So that is what I would just want to say.
And the second thing is, so these APAO travel grants. So at that point of time, I had not even attended much conferences. So Yasuotano, I won the previous year to Prasanna, but right now Prasanna is kind of established in the conferences. So as a young ophthalmologist, that is where your chance is. If you are attending the conference for the first time, there it is highly likely that your posters or your abstracts are going to get accepted, because all the international conferences give preference to the first time attendees. Even if you read the travel grant award itself, there will be a specification which states that preference will be given to first time attendees. So that was my first APAO when I won the travel grant, that is the Yasuo Tano travel grant.
I'm actually,
So
to be
before
honest,
40, he actually mentioned, sorry, Dr. Prasanna actually mentioned less than 40 is the age where you have to hit the mark. So that is when you can win all these travel grants, and WGC does give value to your abstract. Once again, WGC travel grants, if you have a good abstract, your Yasuatano might be difficult, but at the same time, World Glaucoma Congress travel grants are quite easy to win if you have a worthy abstract.
And what about like sometimes we miss the mail on the wet lab sessions. Sometimes they keep us on wait. So in such I had one APO conference where they kept me on the wait list, but fortunately I could because the person had not come up, so I could get the chance. So what happens then? Like, what is the chance that we get the wet lab session?
So the thing is, point is, all these wet lab sessions, as Prasanna also mentioned, you have to keep a watch on the emails. For example, this APAO, there was a call on the email which stated that you can apply as a wet lab trainer. So at that point, I wanted to apply as a wet lab trainer, but somehow I missed the email. So it was towards the end of the this thing last date. I did apply as a wet lab trainer, but unfortunately that didn't happen. So always keep a watch on these emails, and these wet labs are indeed difficult to get. Be as a trainer or as a trainee. Both ways it is difficult. So you have to apply. Early bird always catches the prey. So you have to plan your if it is international, definitely you have to plan ahead, plan what all to submit, plan what all you going to attend, and keep an eye out for these wet lab sessions and these smaller sessions. So because they are going to be very, very helpful for you.
And just to add on to that wet lab part alone, I hope just another 30 seconds. What I felt personally is like, for example, the mixed wet lab. So in 2019, the word mix was very scattered. Like it was just coming in. I remember Dr. Swati ma'am, Dr. Venkatesh sir from Pondicherry talk about that. And when I went to WGC, I was very clear I wanted to go to all the mixed wet labs. So they had around 3 to 4 wet labs. They had a hydrous wet lab, they had a ice tent wet lab, they had a KDB wet lab, they had a ECP wet lab, endocyclophotocoagulation. So it was all paid wet labs. Those wet labs were exclusive and they were never there in any national and any state conference. So I wanted to do it because it's an instinct. See, the company will always push a wet lab only if they see that that is going to come into the market for the next 5 years. You should be the front runner and go and get acclimatized to the technology in that particular conference and wait for the opportunity once you come back. And what we were waiting. So today, whatever minimum I have achieved in MIGS is because I was able to invest in 2019 in a wet lab when I was just finishing my fellowship. So those are some of the gutsy calls. You should not think about the money at that point in time. Whatever the wet lab cost is, if you feel that subspecialty is going to help you, what you see yourself as a glaucoma surgeon, you see yourself as a cornea surgeon, just invest yourself fully into it and go to the end limit. Yeah.
Thanks, Dr. Madhvi and Dr. Prasanna, for adding to all the pointers. Now, moving on to the retina discussion, we have Dr. Devat as a speaker. Dr. Devat, sorry, just a second, Dr. Devat. Dr. Devat is a vitreoretinal surgeon currently in Abu Dhabi, and he has been ex-joint medical director at Chaitram Netralaya Indore, and he has been trained in Shankar Netralaya Chennai in vitreoretina. So Dr. Devitt would like to share his pointers towards which conferences should be attended in retina subspecialty. Dr. Devitt.
Thank you very much. I was amazed to see Prasanna having different hairstyles in each of the conference he has attended. So kudos, man.
Reason one is blonde.
So I think now we should all take inspiration and have different looks at conferences. So thank you everyone, and good evening. So I still remember my first retina conference as a trainee. I was sitting right there, last bench. I was trying to understand the complex slides, and I asked myself, do I even belong here? But years later, after attending so many conferences, I feel conferences are not just about science. They quietly shape your confidence, they shape your connections, and at the end of the day, they give you a sense of career directions. So that is what conferences are for me. So today I would want to share my view on what kind of conferences I usually tend to attend. The agenda of any conference, of course, knowledge upgradation. You want to learn more. The second is visibility, because of course you want to, you want to be visible to as many people as possible. You want to showcase your work. And at the end of the day, networking and research. So these are three important things. But apart from that, what is more important is the after party. Why? Because you actually tend to see the academic faces behind those academic slides. So you tend to meet these people, and eventually, they really help you in shaping. They eventually help you in shaping
They were just stuck on the after party.
Yeah, I think I got stuck on the after party part.
Yeah,
Yeah, so they eventually help in shaping you and how you.
yeah.
So let's go to the national conferences. The first and the so I'll be talking about very specific retina specific conferences. The first one, which is one of my personal favorites, is the RecNet. It is the brainchild of Dr. Mahesh Shanmugam. So why RecNet? Because any case, whenever you see a case, the treatment part I feel is very simple. What is more difficult as a posterior segment surgeon is the approach to that case. So RecNet is basically a case-based conference, and it teaches you how to reach the diagnosis and then how to manage the case. And of course, expert panel. So you're always, enlightened with their out-of-the-box thoughts and tricks. So RecNet is something which I would definitely advocate at a national level. The second one, which is my personal favorite, is the Retina Imaging Congress. Why? Because it is one of the only congresses in the entire world that has a 3-day meeting where they just talk about retinal imaging. So it's kind of a Disneyland with Optos and Claris and OCTAs. So if you are tech savvy, if you want to understand more about how technology can shape the future, Retina Imaging Congress is the way to go. It is the brainchild of Dr. Krishnan Nair and Manoj, and I think they are doing a wonderful job. The third one, which I would personally again recommend, is a tiny meet that is organized by PGI Chandigarh. It is called the Retina Fellow Retreat. So why? Again, this is the only meet where you can actually sit with your mentor on a round table and you don't talk about just your cases. You'll talk about what is the first instrument you should buy, how much you should invest in your first clinic, how do you manage finances along with the medical part. And at the end of the day, if you want to upgrade, when is the right time to do that? So real life practical tips. So that is what you get from Retina Fellow Retreat. And at the end of the day, of course, if you are a retina person, VRSI, that is the Vitreoretinal Society of India, it's a national conference. It gives you definitely national recognition for your work. Very important. One of the reasons I go there is to understand and meet people from the industry. So if they are launching anything new in retina, at the end of the day, they'll be launching at VRSI. So you will get to see the new machinery and technology. And at the end of the day, networking, because all retina surgeons from the country will be there. Apart from that, certain other conferences which I would want to highlight, the Delhi Retina Meet, it is intense, surgical case heavy. The Arise conference, which is a conference by the Eye Foundation. Again, very, very interesting. That is one of the only conferences that talks about AI and machine learning in ophthalmology, and especially in the retina part. The third one is Reticon. It is organized by Agrawals. It's a one-day meet, crisp talks, crisp surgical presentations. Amazing meet. Retina Summit, that is a meet by Shankar Netralay. I think all of you should attend this meet. Why? Because they take one topic, for example, retina detachment or macular hole, and they talk about that for the next 3 days. So from the core to the concepts to the basics, everything is covered. USI, so if you like inflammation more than detachment, Uveitis Society meet is one very good meet. And at the end of the day, Pan Ophthalmologica, that is the brainchild of one of our panelists, Dr. Vaibhav. He gets in a lot of international faculty. And they, more importantly, it's very important to learn from them how they speak and how they prepare their slides. So these are the national conferences I want to highlight. International ones, so two things should favor: timing and your credit card. So if you have a good budget or if you are able to crack a grant, these are the ones to go. So for retina specific conferences, ASCRS, it is one of the most acclaimed meetings in the world. It gives you global credibility, and more importantly, it gives you research opportunities. I will give you a small example. I was just at a coffee table in one of these meetings, and I just started interacting with one of the guys from New Zealand. And then he started talking about his AI-based fundus camera. And eventually we landed up having a publication together in the same, in the same field. Then he sent a fundus camera to my hospital, and we could actually have an AI-based demo trial for this camera. So eventually we landed up with 3, 4 publications together, and again, global credibility. Also, you know where the future is heading. So that is where, ASRS is extremely valuable. The Europe conferences, URETNA and EVRS, very important. Again, why? Global credibility and research, definitely yes. But what I love about my European colleagues is they have a very different perspective to life. So they, of course, they are working hard, but they have a very, very, very strong work-life balance. They are learning kayaking, they are learning how to sail, somebody is learning finance, somebody is into business. So eventually, great science, networking, and you are enthralled by the thought that success in medicine is not just about working harder, but also living better. So that is what URETNA teaches you. A little cost effective, I would say, is the APVRS or the APAO conferences. These are relatively cost effective because they are held in the Asia Pacific region. Most of the people who attend this are generally young ophthalmologists. So, there is a crunch as compared to the West. So whenever there is a financial crunch, what happens? You come out with the most creative surgical solutions. So you see some amazing innovations happening at these meetings. So young guys, bold ideas, practical ingenuity, and it's really inspiring. And these are held at beautiful venues. So even if you don't learn anything from the conference, you will come enlightened just by looking at the scenery of the place. Other international conferences which I personally love to attend, the Witt Buckle Society, if you are a retinal detachment enthusiast. Flow Retina, they have very niche topics like ROP and hereditary retinal diseases. The Egyptian Society. So I think Egyptians are one of the high octane surgeons in the world. So if you are in for some high octane surgical drama, Egyptian Vitreoretina Society meetings are the way to go. And if you are practicing in the Middle East or MENA or African regions, MEOM or ESO are great conferences to attend. So at the end of the day, apart from knowledge, visibility, and networking, every conference you can take some time off. You can travel that place, so you can explore that aspect. And more importantly, I mean, you come back learning something new, but it helps in shaping your perspectives, and you know where the world is heading. So that is something which is very important. So learning, travel, and reflection. That is what I would want to sum up from whatever conferences I attend over a period of time. Thank you, and I hope it has given you some insight.
Lovely, Dr. Devat. That that was a nice insight towards the conferences with the lighter side, and also the exact thing that some of us plan is the travel that is associated with these conferences. So now I would like to invite our retina panelists
So
to
before that,
share
let's
their thoughts.
introduce the retina panelist once now.
Yeah, yeah, I'm doing it. So, am I? Is my slide visible,
No,
Rajvi?
no, slides are
No.
not visible.
Okay, wait. Okay. Yes. Now is it visible?
Yes,
Good.
yes.
So I would
So
like, yeah, see, yeah, go ahead.
We are actually joined by two great retina specialists. Both of them are young ophthalmologists, but have like gained a lot in their career right now. So we are very grateful to have Dr. Vaibhav Sethi here, who is working at Arunodaya Desert Eye Hospital as a veterinary surgeon. And as Dr. Devat said, he is the one who is heading Pan Ophthalmologica conferences also. He is an Indian representative to the prestigious European Vitreoretinal Society and a coordinator of EVRS Image Bank also. He has, to his accolades, several hundreds of ophthalmic surgeries, including microincision vitreous surgeries, retinal detachment surgeries, SFIOLs, etc. And he is an invited faculty for various national as well as international conferences. And he also has an honorary diploma from the prestigious Head of Microsurgical Eye Institute, Moscow, Russia. So we are very happy to have you here, sir.
Thank you so much, and nice to know everybody's here. And great talk, Devat. And I think it's quite inspiring. I just got to know about a lot of nice grants, and I'm just turned 40, so A lot of opportunities just been missed out.
So our next panelist is Dr. Prithvi Chandragant, who is a veterinary surgeon currently working in Kerala, and he's published 30 plus articles and delivered 200 plus scientific presentations at various national, state conferences, and international conferences. And he has numerous awards and accolades to its credit. He is a reviewer for journals like APGO, IGO, KJO, and TGOSR. So he is an innovator. He's a great innovator. He has pioneered around 26 plus innovations in ophthalmology, and we're very happy to have you here, Dr. Prithvi.
Thank you, Dr. Raki. Thank you, Dr. Gunjan, for having me here.
So now
This has
let's,
been, yeah.
yeah. Go on, go on.
No, this has been really massive. This webinar of yours has been really massive with so many conferences, so many. I mean, like, it's a gold mine actually. And Dr. Devat has done superb in the sense he has mentioned all the retina conferences that any fellow or a PG would want to go. And for a matter of fact, I would just give a hack to the people who are actually seeing this webinar, where PGs and fellows just go back to YouTube and play this video again and write down all the conferences, make a total list of negotiable, non-negotiable, everything. Just make a full list of all the conferences that was mentioned in this particular webinar, especially Prasanna's, because you will get five conferences in one slide, and he has covered almost all the conferences in the world, and except for the retina, which Dr. Devat has done. So just make the total list of all conferences and go to all the websites of these conferences and put your email address to these websites. Okay, just sign in,
Okay.
log into these conferences websites after making a list, and then you will see the next day onwards you'll be getting all these all the emails that is required that you can choose from. Okay, you can keep on seeing all the emails coming to your IDs, and you can check which one you are interested in, and you can submit your abstracts. You can participate in all the award competitions, whatever is required, the grants, everything will be there in your email ID. Just check your email ID every day, and don't forget to log into each of these websites. So this is going to be the most easiest way of getting into and knowing which conference is happening where, and what you would want to participate, and keep a planner to keep all the dates of each abstract deadlines, so that you don't forget these deadlines. And also you will also get all the wet lab information in the email, also all the mentors that you require and their topics that you require to learn, everything will be there. So this is going to be the best hack. Go back, open YouTube, and make the list and put your email ID in all of these conferences. You will be able to get everything in your email ID then.
Great points, Dr. Prithvi. Vaibhav sir, would you like to speak something about ESCRS, sorry, EVRS?
Yes, I think there was a lovely covered all the important points about retina, and I was quite sort of lot of things even I did not know about certain conferences, which is highlighted very well. But I think one of the very good points about conferences is you get to network with not just international people but even national people. So I met Prithvi first time in Egypt in the Bridge Retina Congress, and since that time we've known each other well, and we became great colleagues and friends. And I met Dhavat in VRSI few years back, and we've been working together in the EVRS Image Bank. So I think the crux of the thing is that definitely science is one very important point where we all focus our energy on, and the networking part is something which sometimes we feel that we tend to shy upon, and we don't network properly. So I think networking with your own colleagues and building a good team and making actually a good team work out of it. And Pan of Morica, the meeting that I run is basically I don't run the meeting at all, and I'm not heading it. I'm just a part of it, and the main work is done by all my colleagues and my dear friends like Prithvi and David, who are actually running the session there. So we actually this year we actually had 100 Vitretna national colleagues who were running together and moderating around 100 international faculty from 45 countries over 4 hours. And that's a huge amount of knowledge and networking that really is possible because everybody enjoys it and comes together on the same platform and works together. Similarly, EVRS is something which is a very good international meeting in the reason that the AVRS is actually like a family. It's not a typical big conference like an ASRS conference where you actually get lost. In AVRS, it's a more of a family kind of gathering, and even the president, the vice president, everybody is very willing and open, and they want to meet you. They want to understand what you do, and they encourage everybody to participate. So it and they have special preference for young ophthalmologists, and they're given opportunity like people, me and Devat and everybody to actually grow and work together. So this is a good and it's a focused small meeting. So it's a very good meeting to showcase your work and meet everybody, network everybody, and that's how I think we all grow together. So growing does not mean that you grow and I mean you're not going to be growing alone. It's always you're going to be growing together with everyone together. So that's what I would like to just say. Thank you.
So I would like to mention two, three other conferences. One is the World ROP Congress. I think that happens every 2 years. So pediatric retina specialist. It's a good place where you can actually find a lot of pediatric retina specialists. So World ROP Congress is one thing, and like Dr. Viber said, the place where we met, Bridge Retina Congress, really good place for fellows to actually go compete there. They actually give you observership and fellowship under renowned retina specialists all over Europe, and the whole thing is covered by the Bridge Retina Congress conference. So that is a very good place where fellows can actually go and try their cases and videos and such like that. And then there is a World Retina Congress and Delhi Retina Meet also happening. In Delhi Retina Meet happens in Delhi. Good place for fellows to learn a lot of things. And also World Retina Congress is something which I think was missed out. But yeah, these are other four congress which could actually benefit the fellows.
So I think we have Dr. Maria here, who is a young aspiring vitreoretinal surgeon, and she is having a few questions for the panelist. Dr. Maria, are you here? Please unmute yourself.
Yes, ma'am, I'm here. Good evening, everyone. Sir, as a Vitreoretina fellow, what will be the one or two conferences in which wet lab which will give us the best exposure or maximum exposure, sir, as a beginner?
Yes,
So
Doctor.
there's also one conference that is there. It happens in Greece every year. It's called Thessaloniki VR Summer School. Vitretna Summer School has been happening for many, many years by Professor Thanasius, who's a Greek VR surgeon, very renowned surgeon. And there you actually get hands-on training as well as skill transfer from a lot of pioneers who are there internationally, from Japan, from all across the world. So they come and they teach you their personal skills. They take classes and they take different presentations. So that's a very interesting way of learning. It's only dedicated 1 week retina training program of wet lab, where a lot of doctors come in and then they fly out, but they stay for 2 or 3 days. And during the whole process, you learn from around 20, 25 different faculties on how do they do different kind of surgical procedures. That's one international conference you can also think about.
Okay, sir, thank you.
I think Vaibhav, the EVRS school also, I think they are also quite amazing.
Yes, you're right. The EVR school is also very good.
Mm.
That happens in Turkey, and this time it's happening in Ankara. That's also very good, and a lot of similar kind of concept where Dr. Sengul and Dr. Barbara they moderate and Dr. Gampalo who actually call in a lot of faculty, very renowned faculty, and who come and teach you different surgical skill sets which you can learn very well. Any other David you like to recommend?
Any
Yes,
Or
these
such
are
Prithvi?
things in
two
India?
beautiful ones. India, I think VRSI is the one. I mean, they launch everything there and they have good wet labs there. Just that you need to find the right mentor there. That's it.
Okay. So, any more to add, Dr. Prithvi?
I think moral of the story is focused meets are always better than the shosha meets. That is the moral of the story. AIOS and all, I think if you want to have a dance performance alongside Prasanna, I think they are the perfect ones. Otherwise, I think the
Electric.
focused,
Yes.
yeah, focused me, or you want to hear about singing. So I think they are the conferences. Otherwise, I think focused meets are the way to go
I
ahead.
consciously deleted those slides. I had it. I felt not for this, not for this, not no socio-cultural for this webinar.
You were all waiting for it, Prasanna.
No, but actually, jokes apart, but somebody was asking, no, non-negotiable conferences. I would say your state as well as your national conference, AOS and Yosi, because I was just wondering how I met Raki, Daivat, Vaibhav sir, all for the first time as this event was transcending. Raki and me met for the first time in Mumbai
Yes.
2022 AOS. Daivat and me met for the first time physically in again Mumbai 2022 AOS. I would have met Prithvi also there only for the first time. Rather, had he not been a junior to my wife in Arvindai Hospital. Otherwise, I think physically, am I right, Prithvi? We met for the first time in 2022 AOS. So as I see, and Sir Vaibhav, sir, I think uh,
Yosikon, when I was young.
Yosi,
Yes.
A was Yosi
Still
Forum.
young, sir.
So A was no, no, sir. Sir is always young.
This year
Sir
only I
only
turned
disclosed
40,
that he's
so
40. Again, Gunjan also, I think we met Mumbai 2022 AOS for the first time, if I'm not wrong. So non-negotiable conferences are very clear. Your state conference, annual conference, which happens every year, and the All India conference, the senior body, and of course the junior body. Even Dr. Madhavi ma'am, I think in TNOA we got connected. So these three conferences are the non-negotiable ones because these three give you your subspecialty arm as well. Every thing has their subspecialty arm.
So,
and
I
also
think
yes, and also get your chance to evolve your hairstyle before you turn 40. Young ophthalmologist. So that beyond that, I don't have much scope left, but I'll try it Prasanna's way.
Sir,
Maybe
try
some.
try me, sir. We'll talk in
I'll
call.
see what happens
We'll
20 years down the
work
line.
something out
How will
for
you
you.
keep changing your hairstyle? Yes.
I have hair extensions as well.
Oh yes.
so I
Even
think
Dr. Maria, sorry, Dr. Maria is here. I think we met for the first time in one of the AO's international conference. I think Yo Global and AO's international. So
Singapore, sir.
Singapore. AO's is a no-brainer. AOS, Yosi, and the state conference. It's a no-brainer.
And
AIOS
and
is
W Women Orthodox Society also. If you invited WS.
it's like AIOS only now.
Okay.
AIOS is the place where all the specialities meet each other.
Yes.
Otherwise, if you keep on going to focus meeting, then you keep on meeting retina specialists and cornea specialists in each meets. So if you want to meet other specialty people, you come to AIOS or some other, big conference where you can meet each other.
so true. So I think it's time to wrap up. So we are nearing the end of this session. I think everybody who has attended this session has got very insightful information regarding which conferences to attend for all the specialties, cornea, retina, and glaucoma. And all the speakers, I really thank you as a part of Yosi for preparing such beautiful slides covering almost all the necessary information, and also for the panelists for sharing their insightful tips and their journey and their experiences with every conferences. So so to end, I would like to invite each and everybody who are the young ophthalmologists over here to attend the YosiCon, which will again be a very good conference for networking, for making friends, and for being a first-time speaker, moderator, or panelist if you have any stage fear. So welcome all to YosiCon. With this, we are almost going to end, and let's all have dinner. So before that, please switch on your screens and let's take a group photo.
Some are already having dinner, so they can't switch on the camera.
Dr. Ronak is here.
Ronak is also here. Ronak,
Yeah,
I've got blonde.
he's sponsoring a dinner
I've got blonde
symposium
now.
today.
Oh yeah,
Dinner symposium from
I
Rakhi.
saw. I was actually driving.
Okay.
Dr. Manjula, can you take a screenshot? Prasanna?
Yeah,
Manjula,
I'll also do.
Yeah, yeah.
I can also do. Am I allowed? Okay.
Yes, yes.
Anybody,
Sure.
anybody.
3, 2, 1.
Great.
Okay. So once again, thank you everyone for agreeing to be part of this webinar.
Thank you, Rakhi.
Thank you,
Thank you
Rakhi.
for
Thank you so
connecting
much.
us
Thank
all.
you.
Thank you, Rakhi.
everyone.